The objective of this video is to describe the process, preliminary duties, and equipment required for sample collection. Collection is the first step in the process of diagnosing a patient for COVID-19. It is important to ensure that the appropriate samples are collected in time and in adherence to clinical guidelines to ensure greater accuracy of the diagnosis. These tasks include 1. Filling out the COVID-19 questionnaire, 2. Filling out the lab request form, 3. Creating a rapport with patient, 4. Attain verbal consent, 5. Identifying a working area within the isolation room, 6. Explaining the sample collection, 7. Washing hands, and 8. Putting on the appropriate PPEs. Currently in Kenya, the samples being collected to make a COVID-19 diagnosis include 1. The nasopharyngeal swab, and 2. The oropharyngeal swab. Although the studies are underway to understand if other sampling methods may be used to diagnose COVID-19. The upper respiratory tract, the nasal swab or the nasopharyngeal wash or aspirate, or the lower respiratory tract, we have the sputum, the tracheal aspirates, bronchoalveolar lavage, fluid, blood or serum, and all blood. Collecting of samples. The healthcare workers must be prepared with the proper personal protective equipment before collecting of samples. List out the equipment needed to collect the samples. Use the image as guidance. Explain that the swab should be held correctly in order to extract the sample correctly and avoid damage to the patient. Collecting of the oropharyngeal swab. Aim at swabbing the pharynx, the pink, without touching the tongue or the tonsils. Place the swab into the tube containing the viral transport media. Lift the swabs slightly upwards and cut the plastic handle using the scissors previously disinfected. The part of the swab left in the VTM should allow one to close the cryovial with ease. Put the collected samples, the NP and OP swabs, inside the cool box. Label the cryovial with the name of the health facility, the patient's ID, and date collected. Collecting the nasopharyngeal swab. This will be demonstrated and explained in steps. You disinfect the working procedure area. Then you reassure the patient by explaining the procedure. The patient should not blow their noses, just clean the outside of the nose. Blowing the nose may lead to less optimal samples. Ensure you stand on the patient's side as he or she is likely to sneeze after the procedure. Visualize the patient's nostril correctly. Adequate lighting is necessary. Position and tilt the patient's head at 70 degrees to visualize the nasal area clearly. The importance of correctly documenting samples to ensure accurate diagnosis and data collection. For each sample, at least 3 unique identifiers are required to ensure the sample is not lost or assigned to the wrong patient. Patient name may alternatively use initials or unique identifier, patient ID number, specimen types, or date sample is collected. Also include the case investigation form in the package to communicate the critical data on the patient and sample to the lab. Depending on the lab protocol, healthcare workers may alternatively summarize the key details for easier processing.